Okay, I have put most of our electrodes on already, but I'm going to show you how to do a couple here. So I have my electrode and I just I've scooped some paste into my electrode here. So that's the top of it. It can autofocus. And then I just filled the cup with some electrode paste. And here I'm going to put on C3. So, can you tilt your head this way? There we go. So I just spread my hair out where I find my intersection, where I've prepped, and I'm just going to firmly push that down. And you're going to have some of your electrode paste, if you can see it come out the top of that. And then if you do have your gauze or your cover roll, we would go over it. If you didn't have that, the gauze, you just push your paste down. And what some people like to do is they like to take a couple pieces of hair, couple strands, not much, and they like to crisscross it, I'm not doing a very good crisscross here, over top of that electrode to help secure it in place. Okay, I personally always used collodion when I did my patient hookups when I was practicing sleep tech, which is a glue. It's an ether-based glue, and you used a little air pump to dry it. So I'm not a big fan of haste. But that is how you apply electrode. We'll do another one here. Again, you're just going to separate the hair, find where you've prepped, which should be right at the intersection of each electrode site. You want to kind of get the hairs out of your way. And then you just firmly press on your electrode. The paste will come out the top. And then if you have your gauze or cover roll, oops, you place it over top. Now notice how I have arranged the wires coming off of each of the electrodes. Tilt your head. Oops. I have them all facing towards the back of her head. This wire comes straight to the back, this comes straight to the back, these come, every single one of my wires is arranged so the wire of the electrode comes off the back of the head. This is important when we bundle our wires later in the process. Next we're going to hook up or apply electrode to the A1 site, which is our reference, left-sided reference electrode. So you find where you've prepped. Can you tilt your head a little? And then here, again, I rather than placing my electrode like this or like this, I angle it down a little bit, like so.
Oh, sorry.
It's okay. And then go over top with my gauze or my cover roll. Oops. Take some manual dexterity and stick that down firmly. Like so. Next we'll do the left eye. And I wouldn't maybe move my patient's head quite like I'm moving my daughter's, but in this eye one I always tuck over the ear. Again, with your cover roll or your gauze, you want to be careful not to poke your patient in the eye. Seems obvious, but it's easy to do when you're focused on a task. So, there you go. Okay, can you turn a little bit here, Kira? Let's do the chin. Again, the chin is about 1 centimeter up from that bone, right in the center of the chin. Put your head back. There you go. And again, I take the wire and tuck it behind the ear. Well, I try. Oh, it's coming off. Whoa. I maybe didn't prep very good there, huh? At this point, your patient typically asks you, now you expect me to sleep with all this stuff on? And the answer is yes. You will go to sleep. If you remember about our discussion in fundamentals class on excessive daytime sleepiness, sleepiness is not normal, and they wouldn't be here if they weren't having a problem with sleepiness. So they will fall asleep. Again, this one I will tuck behind that ear. Now your next chin electrode, you could go either way. You could go over the other ear, or you could angle it on this side as well. And I am going to stay with the same side. Oh, keep your head back, please. Alright, sit up. There we go. So we have all of our EEG electrodes on. We have both of our eyes on now. We have our chin, and we have our reference electrodes. Our next video, we're going to look at checking the impedance and applying other parts of our equipment.